in that second stage, we are making meaningful modifications to the original stay-at-home order. I mentioned yesterday, I'll reinforce today, over 70% of our economy in the state of California is open with modifications, and I'm sober with modifications. Today, we're announcing additional modifications statewide for our stay-at-home order that include offices. If you cannot telework, we will allow for office modification and office openings on a statewide basis. We are also on a statewide basis making it clear that malls and those that otherwise are not just traditional enclosed malls, but strip malls and those outlet malls can be opened for pickup. And I want to distinguish again for pickup. So not dissimilar to the announcement we made last week for retail. This also would include malls, but again, only for pickup. So offices and malls for pickup, in addition to other services like car washes, pet grooming, making some clarifications, though there's been some of this happening already on dog walking. All of these areas also are being modified statewide. And I remind everybody, what I mean by statewide is the following. And forgive us, I know how confusing all of this can be. Again, it's dynamic. The statewide order affords the opportunity for local government to come in to conform with those guidelines. But one can choose, region like the Bay Area and the 6 counties can choose to be a little bit more prescriptive and restrictive, parts of Southern California, LA, and others the same. So not everyone is compelled into this phase, but that phase is afforded everybody. And so those that are also trying to get variances on the other side of this to loosen up and move deeper into phase 2 more quickly should know that this statewide order applies to them even if they're in the process of applying to get the technical support to do a self-certification for a regional variance. So we are updating those guidelines. They're available as I speak on our covid19.ca.gov website. You can go to that. You can see what additional modifications we're making statewide to the stay-at-home order, but progress in this space that I hope is encouraging to many. But that progress, again, is predicated on our testing, on our tracing capacity, and on the basis of the numbers that I will update you in a moment on, hospitalizations, ICUs, and the like, that we continue to track and continue to show encouraging signs in the stability that is the predicate for allowing us to move in this direction. Data, public health, science-based decision-making. Accordingly, today, as I was clear we would introduce, today we are now making public the guidelines for a number of other industries in this state, including the restaurant industry, and guidelines for reopening in-room dining, so to speak, or dine-in restaurants. Remember, restaurants are, many of them, open for takeout, but this would allow patrons to start coming back in these counties that have conditions that afford this. We made very clear last week the conditions we're looking for to go deeper into phase 2, and we made it clear that today we would put out those guidelines. We have also put that up on that covid19.ca.gov website. So you'll see guidelines statewide updated, and you'll see guidelines county by county that we are putting out today for a number of different industries. By the way, those industries include but are not limited to well, outdoor museums, botanical gardens. And by the way, that's also available in terms of a statewide order. But we put out prescriptive guidelines in terms of what we look for in the reopening of outdoor museums. We provide similarly guidelines for car washes and for restaurants. And we today can announce that based upon consultation, technical consultation, and the self-certification and attestation that was done in concurrence with health director, their county administrators, including county boards of supervisors, focusing on the needs of the most vulnerable, potential surge, and self-attesting that they have a plan to begin to modify these loosenings if we start to see a spread of COVID-19. That Butte now is on our website as the first county that now is able to move deeper into that phase 2 through their self-certification process, through their planning work that they've done. So Butte County and El Dorado County have met those thresholds and work incredibly collaboratively with our department teams and health officials. I should note that we have been in contact with 27 counties. In total, 4 we're having deep technical assistance calls today, and those are dynamic conversations. I have confidence that just this afternoon there will be 2 additional counties that should self-attest. They're working through more formal votes at their local counties and their local jurisdictions to codify their recommendations. And based on the interaction with us, we'll put those up on our website as well. So progress in this place, but soberly we make the point. I don't anticipate every one of the 27 counties that we've engaged with already, the 4 that we will be engaging with this afternoon, all will be able to self-attest. And I know that this is a point of concern and consternation. It was brought up just yesterday with the wonderful outreach and the spirited cooperation we received from Kern County that described in their county certain conditions that they would like our health directors to consider to allow a modification of sorts based upon data, based on science, based upon their unique circumstances where we can apply some flexibility. I said this 10 days ago when we rolled this out originally. We're not ideologues. Our team, and it's not just our team, it's the collective wisdom of also health directors across the state of California. We are in the spirit of collaboration and partnership, want to address those issues, and we'll be doing so to the extent possible, again, possible on the basis, again, of public health being the foundational guideline and principle. But there are some unique characteristics within counties where they're hitting on all cylinders, and where they hit 13 out of the 14 guidelines to get into a variance, and they have a unique circumstance with a federal prison, for example, or a state prison they don't manage, or a skilled nursing facility that had some challenges but they feel like they have under control. Those things are all part of the dynamic engagement and conversations that we look forward to having. I know there's an eagerness to resume those conversations that we had over the weekend and conclude them. We will do everything in our power as quickly as possible to adjudicate all of these nuances and details and be as fair-minded as we possibly can. I just want to make that clear to everybody watching, also members of the press, that we are committed to this dynamic process. Also implied yesterday, and I hope you're seeing it here today, the fluidity of these announcements, that they're not static. As conditions present themselves, as indicators turn from yellow to green, we'll be updating our site on a fairly consistent basis. And we will be directing that through the Department of Public Health, primarily, not even just traditionally through these press conferences. So I want folks to know we'll be making adjustments and modifications on a consistent basis statewide, and also providing updates on these regional variances. Whole idea is to get us all through this phase 2 so we can start to move into phase 3. We are not there, phase 3, yet, but there are parts of the state that can and now are moving deeper through phase 2, and I hope that's an encouraging sign, both from a health perspective and an economic perspective. It's an and for us, not an or. And I deeply recognize health is defined not only by taming the beast that is coronavirus or C-19, as it's now often being referred to, but also addressing social determinants of health and the impact of poverty as it relates to the health of families and communities all across this state, physical as well as mental health. All of these are factors. We don't see them as competing factors as much as we see them as in a collaborative frame in the context of a broader health frame. But again, guided by health and guided by data, we will continue to march down this path of more meaningful ratifications, and again, in real time. And so, again, keep taking a look at that COVID-19 website. It's a dynamic website updated on a consistent basis. And in that respect, I also want to make something available and also just make you aware of what's been on our site. You can look at the attestations, which is just the self-certification of the containment plans and the protection plans that, for example, Butte County is putting up. You can take a look at that on the map, county by county, but you also have the ability on our site to look at the total number of positive cases that have been identified in Butte, the number of people hospitalized, the number of people in ICUs by county throughout the state of California. I'd encourage people to take a look at that. This is about self-certification, and we'll all collectively be monitoring people's success in this space. And we believe success is an imperative, but also success leaves clues. Success can also provide capacity and guidelines for subsequent efforts in other counties. Each one of these self-certifications and attestations becomes its own best practice, and I hope informs others in that process. But we must always be informed by data. And on the covid19.ca.gov website, you could go county by county and on a daily basis get updated on how well your county is doing and whether or not they're reaching those prescribed goals in their self-certification. So want folks to be aware of that as well. And so we'll keep adding all that information to that database, that dashboard, and continue to monitor the success, we believe and hope, of these counties that are moving more quickly into phase 2. So that's broad strokes what I wanted to communicate and share today. Good news on testing, progress, not where we need to go, but progress nonetheless. More places to go in rural California, as well as now with pharmacies throughout the state of California. More opportunity now to reopen based upon the ability to get more support for tracing, isolation, and quarantine, and continue to develop the kind of dynamic partnership, two-way conversation with our team, our staff, your team, your staff. We're taxpayers, all of us, the folks that are trying to do their best to help you and help your community to move quickly into this phase 2, but do so safely so that we can protect everybody